If your shoulder is hurting and you've been trying to stretch it out, there's a chance you're actually doing more harm than good. That's because not all shoulder pain works the same way. Some types improve with gentle movement, while others flare up when you target the wrong spot. In this video, I'm going to guide you through 3 straightforward shoulder tests you can follow along with right now, whether you're sitting or standing. Each test gives us a specific clue about what's going wrong in your shoulder, and from there, I'll point you toward the right starting point for recovery. While you're going through these tests, focus on 2 things: where exactly you feel the discomfort and whether your arm feels painful, weak, or a combination of both. That distinction is going to matter a lot. Let's jump into the first test together. Test 1, the side lift pinch. Start by letting your arm hang loosely at your side. Now slowly raise it straight out to the side with your palm facing down. Take your time. No need to rush. For the first part of the movement, it should feel completely fine. Then, somewhere in the middle range, you might notice a sharp pinch, an aching catch, or a sensation that makes you want to stop. If that happens anywhere through that mid-range, you've identified your pinch zone. Here's something that catches most people off guard. If you keep lifting the arm past that painful spot, the discomfort often fades away. Pain in the middle, then relief at the top. That specific pattern is what we call the side lift pinch, and it tells us something precise about what's happening inside your shoulder. There's a small gap between the upper arm bone and the bone that sits on top of the shoulder. As your arm travels through that middle range of motion, the soft tissue inside that gap gets compressed. That's the pinch. You've likely felt it before when reaching for something on a high shelf, sliding on a jacket, grabbing your seatbelt, or lifting a bag off a surface. If any of that rings true for you, the exercises for this type are coming up shortly. But before we get there, let's run through the other 2 tests because it's quite common for more than one pattern to be present at the same time. Clinicians refer to this as the painful arc. Now you understand exactly why. Test 2, the empty can. Extend your arm straight out in front of you and angle it slightly to the side, roughly halfway between pointing forward and pointing sideways. Now rotate your thumb downward, as if you're tipping a can to pour out the last bit of water. Hold that position. If someone is around, ask them to gently press down on your wrist while you resist. If you're on your own, use your other hand to apply light downward pressure while trying to hold the arm up. If that produces pain at the top or front of the shoulder, or if the arm feels unexpectedly weak, that's a positive empty can result. It points directly to one specific rotator cuff muscle, the supraspinatus. This is the muscle that kicks in whenever you first begin raising your arm. When it's irritated or underpowered, everyday tasks become a struggle. Reaching overhead, loading dishes, washing your hair, pulling a shirt on over your head. Most people assume their whole shoulder is the problem. In reality, it's usually just this one muscle. The exercises to address it are on the way, but first, one more test, because the third one picks up on something the first 2 can miss. Test 3, the outward turn test, resisted external rotation. Bend your elbow to 90 degrees and hold it snug against your side. Now try to rotate your forearm outward, pressing it against a wall or door frame. If that creates pain along the outer or back part of the shoulder, or if it feels noticeably weaker than the other side, take note of that. This pattern shows up frequently in people who experience discomfort while steering a car, pulling open a door, grabbing a seat belt, or turning the arm away from the body. If more than one test produce symptoms, don't worry. That's very common. You don't need a perfect diagnosis. Just ask yourself one question: which test felt most similar to the pain you deal with in real life? That's where you begin. Here's how the rest of this works. I'll walk through exercises for each test in sequence. When I reach your test, pay close attention. But honestly, try to watch all 3 sections even if only one test bothered you. The other exercises can help you avoid the next problem before it develops. Exercises for the side lift pinch. Exercise 1, pendulum swing. This is the gentlest starting point. There's no lifting involved and no muscular effort, just gravity doing the work for you. Stand next to a sturdy table or the back of a chair at roughly waist height. Place the hand of your unaffected arm on the surface and lean slightly forward. Let the sore arm dangle straight down, completely relaxed. Release any tension in it. Let it feel heavy, like a rope hanging loose from the shoulder socket. Begin with small, easy swings forward and back. Keep them short and unhurried. Not wide, not fast. Just a quiet pendulum motion. Keep breathing. About 30 seconds of this. Then shift to side swings for another 30 seconds. Follow that with small clockwise circles. Imagine tracing a dinner plate-sized circle on the floor with your fingertips. 30 seconds clockwise, then 30 seconds in the opposite direction. The whole sequence takes about 2 minutes. Here's why it works. When the arm hangs freely, its own weight gently draws the upper arm bone downward and away from the bone above it. That creates space right where the pinching occurs. Because you're not lifting against gravity at all, it's one of the safest possible movements for a shoulder in this condition. A few things to be careful about. If your swings get too wide or fast, the shoulder muscles will engage to control the movement, which defeats the whole purpose. Keep it small and relaxed. Avoid rounding your back too much. A slight forward lean is all you need. And make sure your support surface is stable. If this already feels more comfortable than lifting your arm does, that's a good sign. It means your joint responds well to having that space opened up. Hold on to that feeling as your reference point. Exercise 2, table slide. Now we'll take the arm through some range of motion, but with the table doing all the supporting work. Sit down in front of a table and place a small cloth or hand towel on the surface so it can slide easily. Rest the forearm of your sore arm flat on the towel, palm facing down, elbow close to the body. Slowly slide the towel forward across the table, letting the arm glide out in front of you. Go until you feel a gentle stretch in the shoulder, not pain. The moment real discomfort kicks in, stop right there. Hold for a moment, then slowly slide back. That's 1 rep. Aim for 8 to 10 repetitions. Slide forward smoothly, pause, return. Exhale on the way out, inhale on the way back. What this accomplishes, the table carries the full weight of the arm, so the irritated structures inside the shoulder don't have to do any work to hold it up. They get a genuine rest while you gradually rebuild range of motion. The most common error here is reaching too far too quickly. Pushing past the first sign of real discomfort irritates the exact structures you're trying to settle down. Think of it as asking for permission rather than forcing entry. Also, keep your posture upright. Don't lean the whole torso forward to gain extra range. The motion should come from the shoulder itself. Exercise 3, seated shoulder blade squeeze. This one may look simple, but it's arguably the most important of the 3. Here's the reason. The way your shoulder blade moves has a direct influence on how much room exists for the pinch structures. If the blade isn't moving properly, the pinch zone stays compressed no matter how much you stretch. Sit tall with your feet flat on the floor and both arms relaxed at your sides. Now gently draw the shoulder blades together toward the spine and slightly downward. Imagine tucking them into back pockets. Don't shrug your shoulders up. Don't arch your lower back. It's a small, deliberate movement. Squeeze and hold for about 5 seconds, then release slowly. 8 to 10 reps. The effort should be felt in the middle of the upper back, between the blades, not in the neck or arms. When the shoulder blades sit correctly and move well, the bone on top of the shoulder rises slightly and the pinch zone opens up naturally. Many people find that the side lift pinch begins improving within 1 to 2 weeks of doing just this exercise consistently. Do all 3, pendulum, table slide, and shoulder blade squeeze, once or twice per day. In the first 3 to 7 days, some mild soreness after the exercises is normal. That means the muscles are being activated again. Sharp pain during any movement is not normal. If something is sharp, reduce the range or effort and try again the next day. Exercises for the empty can. If the empty can test came back positive, the supraspinatus needs dedicated attention. This muscle may be irritated, weakened, or both. The key to rehabilitating it isn't to push through, it's to be strategic. Settle it down first, then gradually reload it. Exercise 1, wall slide. Stand facing a wall, roughly 1 step back. Place both forearms flat against the surface at about shoulder height, elbows bent, forearms and palms in full contact with the wall. Slowly slide both arms upward. Keep the forearms touching the wall throughout the movement. Go as high as is comfortable without forcing past resistance, then slide back down to the start. 8 to 10 reps. Exhale on the way up, inhale on the way down. 2 things to watch. First, don't let the forearms peel away from the wall, and if they do, you've gone too high. Second, don't arch the lower back as the arms rise. Keep the core lightly engaged and the ribs down. If this is entirely pain-free from the beginning, that's a green light. You're ready to move on to the next exercise. If there's mild discomfort near the top, simply work within the range that's challenging but not painful. Exercise 2, isometric press into the wall. This is where genuine strengthening begins, but done in the safest possible way. The muscle works without the joint moving at all. Stand with your sore side facing the wall. Bend the elbow to 90 degrees. Press the outside of the elbow gently into the wall as though trying to lift the arm outward, but let the wall resist that movement so nothing actually moves. Hold the press. Begin at about 30% of your maximum effort. That will feel like almost nothing, and that's intentional. Hold for 8 to 10 seconds, then release slowly. 5 reps total. The most critical aspect of this exercise is progression. After 3 to 5 days at 30% effort, if your pain hasn't increased, move up to around 50%.
After another week, try 60%.
Never jump to maximum effort and never push into sharp pain. Most people's instinct is to go hard and fast. Resist that. With a supraspinatus, patience consistently outperforms intensity. If you've been trying to strengthen your shoulder and it keeps flaring up, this is most likely why. Too much load, too soon. Do the wall slide first to warm up the movement pattern, then follow with the isometric hold for strength. Most people notice the empty can test becoming easier within 2 to 3 weeks. Exercises for the outward turn test. If the outward turn test was painful for you, the external rotators have been neglected. These muscles rotate the arm away from the body, and almost everything in modern daily life works against them. Typing, driving, cooking, carrying, all of it pulls the arm inward over time. The outward rotators gradually weaken until one day they start producing pain. 2 exercises, mobility first, then strength. Exercise 1, assisted external rotation with a stick. Pick up a light stick. A cane, a dowel rod, or even a broom handle will work. Hold it with both hands out in front of you, elbows bent to roughly 90 degrees and resting comfortably at your sides. Now use your unaffected arm to gently push the stick across your body, which will guide the sore arm into outward rotation, the forearm rotating away from your stomach. Keep the elbow on the sore side pressed against your side throughout. Only the forearm moves. Go only as far as is comfortable, then return to center. 8 to 10 reps. 2 things to avoid. Don't let the elbow drift away from the body. If it does, you've gone too far. And don't rotate your whole trunk to create extra range. Keep the motion small, clean, and isolated at the shoulder. Your unaffected arm is doing the guiding. The sore side is being carried through the movement, not forcing its way through. Exercise 2, isometric outward rotation into a wall. Now for strengthening, using the same isometric principle as before, but targeting the external rotators. Stand with your sore side toward a wall, elbow bent to 90 degrees and firmly against your side, forearm pointing forward. Press the back of your wrist into the wall as though trying to rotate the forearm outward, but let the wall stop all movement. Hold the press. Start at about 30% effort. 8 to 10 seconds per hold. Release slowly. 5 reps. Keep the elbow locked against the side. If it drifts out, the wrong muscles take over and the exercise loses its effect. The contact point with the wall should be the back of the wrist bone, not a flat palm. Follow the same progression as before. 30% for the first few days, then 50%, then 60% after another week. Never push to maximum. Never push through sharp pain. An important note before we finish. These tests and exercises are well suited for common mechanical shoulder pain, but please consult a doctor or physical therapist if any of the following apply to you. Your pain began after a fall or accident and hasn't improved within a few days. Your shoulder feels unstable or as though it might give way. You're waking up regularly from night pain and can't find a comfortable position. Your weakness is getting progressively worse, or you've been doing the right exercises consistently for 3 to 4 weeks with no change. These signs could indicate a tear, a fracture, or another issue that requires imaging. Don't wait it out if any of those sound like your situation. Your plan for the next 7 days. If the side lift pinch test bothered you most, do those 3 exercises once daily. Don't add the other sections yet. If the empty can was your main issue, perform the wall slide and isometric press every day starting at 30% effort. Don't rush it. If the outward turn was your problem, start with the assisted rotation exercise before moving to the isometric. Don't skip the mobility work. If 2 or all 3 tests were positive, begin with the one that most closely matches your real-life pain. Stick with those exercises for 1 full week, then return to this video and layer in the next set. After about a week, retest your shoulder. If the movement that bothered you feels even slightly easier, not perfect, just a little better, that's genuine progress. If nothing has shifted, revisit your form, slow the movements down, and make sure you're not working into sharp pain. If you watched this and thought, that doesn't quite match what I'm feeling, leave a comment and describe which movement causes you the most trouble. If enough people mention the same thing, I'll create a follow-up covering the shoulder patterns I didn't get to today. You can also let me know which test matched your experience, 1, 2, 3, or more than one. I read through the comments and they genuinely shape what I decide to make next. If this was useful, feel free to subscribe. New videos go up every week, always with the same goal, helping you move more comfortably and stay independent. Thanks for watching, and I'll see you in the next one.